Hello, I am Justin Keller, EMT, and this video shows the relationship between an electrocardiogram, or ECG, sometimes called EKG, and the heart. This video does not get too in-depth on the ECG itself, but just shows the relation to the different parts of the ECG and the heart. So first, it is important to know the different parts of an ECG. So these are going to be the different parts. The main parts, we have the P wave, we have the QRS complex, and then we have the T wave. We also have the different intervals. Each of these intervals should be within a specific length of time. We have the PR interval between the top of the P wave and the R of the QRS complex. We have the QT interval from the Q of the QRS complex to the top in the middle of the T wave, and then we have the ST interval from the S of the QRS complex to the middle of the T wave. This place is also important because this is the ST segment, and we'll show why that is important later. The other important value is how long the QRS complex is, because that will determine if it's narrow or wide, depending on if it is less than or more than 0.12 seconds. First up, we have the P wave. The P wave represents the sinoatrial node firing, and due to the SA nodes firing, the atria contracting. Next, we have the PQ interval. It should be between 0.12 and 0.20 seconds. A lot happens in this short time. The electrical impulse reaches the AV node, goes to the bundle of His, the left and right bundle branches, and the Purkinje fibers. Next, we have the QRS complex. Here, the ventricles are depolarizing and the atria are repolarizing. However, the atria repolarization is hidden within the ventricles' depolarization when they contract and expel their blood. Finally, we have the T wave. The T wave is the ventricles' repolarization, and then that way they can refill with blood and be ready for the next cardiac conduction cycle.